Hello everyone, my name is Jon Helge Andersen. I am the Director of Strategy in the Directorate of eHealth in Norway. And I will spend some minutes now to introduce you to the Norwegian eHealth landscape and the national eHealth strategy. First, some key facts about Norway and the health and care services. Norway has 5.4 million citizens spread over 400,000 square kilometers, making Norway one of the most sparsely populated countries in Europe. Our government aims to ensure that everyone, irrespective of their personal finances and where they live in the country, has access to good healthcare services of equal standards. To provide for our population, we have around 5,000 general practitioners doing 16 million consultations per year. And in the hospitals, the specialist healthcare, they do 12 million outpatient consultations. And the GPs, as we call them, act as gatekeepers for health and care services. Our health and care services are quite complex when it comes to governance structures. We have many autonomous organizations which we are dependent on collaborating together to create a good health and care service. So on top, obviously, the Parliament, and we have the Ministry of Health and Care Services. And they issue laws and regulations. They draft policies and handles the finances. And they govern my organization, the Norwegian Directorate of eHealth, and we implement national policies on eHealth. We establish national standards and administers the use of national eHealth solutions. And we have the Directorate of eHealth, which executes political decisions, draft policies, advise political leadership in sector, and oversees that the laws are being followed. In addition, we have the regional health authorities, all the hospitals, which are governed by the ministry. The 4 regional health authorities in our country that runs all the hospitals and contracts other specialist providers. And then we have the municipalities. On the right side of this slide, we have 356 municipalities, and they are self-governed. They are responsible for the primary care. They are governed directly from the Parliament, and the GPs, approximately 5,000, 4,006 on this slide, are also part of the primary health care. And this is just a simplified glance of the governance structure. One of the main challenges today is to achieve connected healthcare services across separate lines of governance and a large number of organizations they represent. Therefore, we need a national governance model where the organizations gather together to find good solutions. So this is our vision, mission, and role for the Directorate of eHealth. Just a short glimpse on that. Our vision is to create a simpler health service for everyone by gathering the healthcare sector around a common direction for digitalization. And our 3 roles: catalyst for change, to set the terms for development, and being an advisor for our politicians and for the sector. So let's dive into the national strategy for eHealth. And this is a strategy we have been working on for nearly 2 years now. And we had just finished a broad public hearing, and we aim to close the strategy by end of this year. An important step in the development of a national eHealth strategy is to define the strategic ambitions. And summarized, we have defined 5 strategic ambitions. First, to set a clear, decisive direction, at the same time building on central directions from the sector. 2, formulate very clear priorities and clarify focus areas with mutual dependencies across stakeholders in the sector. Third, ensure interaction between long-term directions, adjusting to new requirements, providing a dynamic strategy. The strategy can set a long-term and predictable direction to the vision and goals. In addition, ensure necessary modifications when requirements change, providing new solutions. This involves important routines for measuring and adjusting goals. Goals can stay firm over a long period of time, but measures must be adjusted when needed. And last but not least, the main target groups for the strategy are citizens and healthcare personnel. This will contribute to strengthening their requirements across the stakeholders. When we worked on this strategy, we had a work process that was structured around two main phases. To develop a knowledge base, and based on that, develop goals and strategy. So in the first phase, we dived into an analysis of the current situation. So what is the existing situation in the field of eHealth? And then we started on a scenario analysis. So what do we know and what do we think about the future? How will that look? And based on this, we developed three areas, three elements. One was the ambition and the vision. Number two was the strategic decisions we need to do. And then how do we follow up and steer the development of the strategy going forward? The National eHealth Strategy is aiming to be the overall digital strategy for the healthcare. It will account for ongoing processes, existing strategies which are local and regional and national, and plans within the healthcare sector and other parts of public sector. So we want this strategy to be the kind of the framework which all the different actors and organizations can tap into. So we have a lot of digitalizations happening on the local and regional area. We have a lot of other governmental institutions and bodies, and we have politicians and laws and regulations. And the National eHealth Strategy needs to cover that we have taken this into account. So the strategy period is from 2023 to 2030. We know that circumstances will change and we need to adjust the strategy in the years ahead. This is the super slide, trying to cover the essence of the strategy in one picture. On top, we have the vision, working together to ensure comprehensive, safe, and innovative services that promote health and empowerment. An important step in the process of developing the strategy is to describe the main goals for achieving digitalization, contributing to an improved and sustainable healthcare services. And this is threefold. The first one is quality and coherence in services. Digitalization contributes to sharing information, cooperation with increased continuation of services. Increased utilization of technology will contribute to higher quality healthcare and strengthen patient safety. Secondly, a sustainable healthcare sector. Demographic changes and lack of access to healthcare personnel raises new challenges. If we are to continue providing high-quality healthcare, technology must contribute to increased productivity with smarter solutions. We must use the resources and competence in the best possible way. And the third overall goal is innovation in the sector. Digitalization drives innovation. It is necessary to create opportunities for action with sufficient capacity for innovation. We will then, to an even greater extent, use technology to provide healthcare in new ways. Innovation is about culture and competency. It is about having the courage to think anew, learning from mistakes and from successes. In addition, the sector must find new ways to collaborate. These three main goals are in line with the strategy for digitalization for public sector overall, not just health and care services. In the middle here, we have the target groups, and the primary target groups are citizens and healthcare personnel. And so we have the 5 strategic goals on the bottom of this slide. And I will spend some time describing each one of them. The first goal we have called an active participation in my health and the health of persons close to me. Digital healthcare will facilitate citizens and relatives so that they can easily be involved in prevention, treatment, and follow-up. This is empowerment. This will contribute to the individual's managing of healthcare and coping with the situation. When, where, and how healthcare services are provided shall to a greater extent be customized to the citizen's needs. This will contribute to the best utilization of competency and capacity. The second goal is simplifying the working day for healthcare personnel. Healthcare personnel will have access to user-friendly digital tools that are integrated, providing beneficial decision-making, supporting their work processes. This will contribute to healthcare personnel having increased time for patient care, reduced undesirable variations in care, and increased patient safety. The third goal is health data for renewal and improvement. Organizations and health authorities will increase their decision-making based on data. More data-driven decisions will contribute to improved resource utilization, quality, and innovation. In addition to improved health monitoring, preparedness, and steering of developments in health at the population level. The fourth goal we have called accessible information and strengthened collaboration. Digital communication must provide effective information flow between organizations so that the healthcare information is accessible when needed. This is a big challenge today. A strengthened information management will lay the foundation for high quality utilization with safeguarded information. Accessible health data will contribute to improved data analysis for use in healthcare and secondary use. And then we have goal 5, collaboration and means facilitating implementation. So this is where government organizations like the Directorate of eHealth, together with a lot of other organizations, needs to find the right tools to stimulate implementation of new technology. Facilitating the ability to implement change in the field of eHealth will be strengthened through improved collaboration and increased use of regulation and financial models. Okay, a strategy can be used and it can be put in a box, not to be used. And we obviously don't want that. So we have quite a focus on how to implement and follow up on the strategy. If this strategy, which we really want, should be a guideline for future decisions, it must be actively used by the stakeholders. Active management and follow-up must be planned. Therefore, there's a need for active steering and follow-up. And we have defined 4 steps doing that. The step 1 is to define the strategic direction and ambitions for the sector. And then step 2, define the goals and develop KPIs and strategic initiatives that support the goals. And then you follow up. Regularly monitoring with follow-ups of goal achievement. And here we have National Advisory Model for eHealth, where all the key stakeholders in the sector are gathered to discuss, are we having the right means in place? Do we solve the right problems? Where are the problems to be solved? And step 4 is to adjust. Based on information from step 3 concerning goal achievements and developments in eHealth, there will be a need to adjust measures and possibly goals. Assessment and adjustments will be treated in the National Advisory Model for eHealth. This is an example of how we think. If we start out with this strategy in 2023, and we have a strategy period until 2030, we need to have a step-by-step implemented measures toward the goals. And we know that the technological environment are changing constantly and very fast. So the measures contribute to interaction between long-term directions, adjusting to needs during the process. For each goal, corresponding KPIs and initiatives need to be identified in order to be able to implement and follow up on the strategy. So goal indicators are utilized to gauge the achievement level for the individual goal. Therefore, they are also used for steering and monitoring goal attainment. Yes, so this was a bit of quick information on the eHealth strategy. But my last point is very important. This is not the strategy of the Directorate for eHealth, and it's not the strategy for the Directorate of Health or for the Ministry of Health and Care. This is the strategy for the sector, for all the hospitals, for all the GPs, for all the municipalities. This is very important. It will be a common language which they can address when they find what they need to do. But we have now kind of a strategy to collect all the needs and the measures we need to take as a nation moving forward. Thank you.